We're missing our doctor. Thank you so much for coming. A couple of technical details. Would everybody please turn their cell phones off? The other technical detail is we are being videoed. We are on Channel 11 TV right now, live. And we will be making a video of tonight's meeting, and it will be available on the League of Women Voters website, www.lwvbuttecounty.org, and it will also be available on the website of the Enterprise Record. The Chico Enterprise Record is our co-sponsor tonight, and I don't know if any of you saw the great ad that David Little put in the paper today. That was unbelievable. We didn't buy that ad. And that was amazing. So he's been a big supporter, and I want to give him credit for that. And he's not here tonight. He couldn't make it. A little bit about the League of Women Voters. We are a nonpartisan, nonprofit political organization, and we encourage informed and active participation in government. We don't support candidates, we don't support a party, but we are political. We're active in our government. We operate at national and local levels. We have about 800 leagues in 50 states, the District of Columbia, the Virgin Islands, and Hong Kong. I don't know the total membership. The League works to increase understanding of major public policy issues and influences public policy through education and advocacy. If you would like to know more about the League, you may ask one of us wearing these buttons, or there's some literature out in the hallway too, if you'd be interested. And we're always interested in getting new members. Tonight in the audience, we have some League members helping. They are passing out cards. If you're going to ask a question of one of the panelists, we would like you to write it down on a card. We have Margaret Swick, Linda Lunsford, Janet Taylor, William, Tef Teller. Anybody else out there that I missed? And Marian Evans. Up at the front, when we collect the questions, they will go to the two past presidents, Carol Burr and Betsy Kruger, my mentors. And they will assemble the questions and put them in an order to give to our panel. Eleanor Anderson, our voter service director, is here this evening. She will give a brief introduction on the Affordable Care Act before our speakers start, and she will help with the timing of the speakers. And Linda Burr, our social policy director, is the one to thank for this evening. Would you stand, please? Just about everything you see here tonight, including all the speakers and everything, goes to Linda. You know, thank you so much for putting this together. Tonight, our aim is to increase an understanding of the Patient Protection and Affordable Care Act. That is the name of the law. We call it the Affordable Care Act, or the ACA, and some of you may still be calling it Obamacare. It's the Affordable Care Act tonight. It's been the law of the land since 2010, and much of it has been implemented already, and more is yet to come. And that's why we're holding this forum tonight, to tell you what's coming. But I'd like Eleanor Anderson to start, and then I will introduce our guests after she tells you a little bit about the CARE Act up till now.
Thanks, Jane.
Do you want to hold this?
No, this is working just fine. So the Affordable Care Act was, as Jane said, was passed on 23 March 2010, and after working its way through the court system, it was upheld by the Supreme Court on 28 June 2012 as being constitutional, although some parts of it were struck down. The Affordable Care Act currently sets new standards that ban the ability to drop policyholders if policyholders become seriously ill. They ban price discrimination on the basis of pre-existing conditions, and also based on gender through what's called a partial community rating. It also allows children and dependents to remain on their parents' insurance plan until their 26th birthday. Under the law's authorization, Kathleen Sebelius, Secretary of Health, issued a set of defined essential health benefits that must be covered under insurance policies going forward. Insurers will be prohibited from imposing annual or lifetime coverage caps on these essential benefits. which cover ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory service, preventive and wellness services, and chronic disease management, and pediatric service, including oral and vision care. Several of the health benefits have already gone into effect under the Affordable Care Act. In 2012, the preventive services, you may have noticed you no longer have copays for many preventive services, including mammograms, colonoscopies, wellness visits, gestational diabetes screenings, amongst many others. Also, contraceptive care beginning in 2012. Contraception is now covered under your premium payment. It's not free contraceptive. It's considered a benefit with zero cost to the person receiving the prescription because they've paid for it under their premium. Also, beginning in 2012, around 2010, coverage for 24 to 26-year-olds being allowed to remain on their parents' health plans was brought into effect as well, allowing many college students or recent graduates to remain covered.
So now we're going to talk about where we go from here, and I want to introduce our speakers. I'll just give you their name and their title, and they will tell you a little bit more about what it is they do. On the far left, our Dr. Thorp is missing. I hope that he gets here. He's the president-elect of the California Medical Association, as well as being a practicing internist up in Paradise. Next to him is Cathi Grams. Cathi is the director of Butte County Employment and Social Services. Next to Cathi is Miss Tatiana Fassieux. Tatiana is the program manager of Passage's HICAP program. And then next to Tatiana is Kristi Fudem and Miss Natalia Butler, who are spokespersons for Covered California, which is the state organization that will be implementing the insurance exchanges in the Affordable Care Act. So I think we'll give them a hand tonight. And they have an overhead presentation to give you as well. So if we could start with you, Cathi, please.
Yes, good evening. I want to thank all of you for taking the time to join us this evening, and hopefully you will walk away with a little better understanding of how the Affordable Care Act impacts you as an individual, your family, your business if you have a business, and our community as a whole. So I am the director of the Butte County of Employment and Social Services, and I've been with the department for 34 years. I've been the director for 9 years, and our department is responsible for administering programs on behalf of the state and federal government, as well as some local programs, so programs that you may be familiar with in terms of some cash assistance, food stamps, now called CalFresh. We have Medi-Cal, Protective Services, Veteran Services Office, just to name a few. So that's what the department does. And so the question then is, you know, what does our department have to do with the Affordable Care Act? And what I can tell you is in my 34 years that I've been with the department, this is probably the biggest undertaking that we have experienced in terms of a social health and social services program that will really change both our community, I think, for the positive, and then also the changes in our own business practice in order to implement that. So what we do now is we implement the current Medi-Cal program. And so it's a natural progression that we would be involved in enrolling and assessing eligibility for those in the Affordable Care Act as well. So that's a little bit about what our county department does and then why we're involved in the Affordable Care Act. So what you heard already is a little bit about what the I'll call it ACA, so I don't have to keep saying Affordable Care Act. What the ACA has already done in terms of enacting a patient bill of rights and setting out a set of essential health benefits that have to be offered by every plan that was just talked about. So you kind of heard about that. The other few things that the Affordable Care Act, I can't help myself, the Affordable Care Act did is it provided expanded health coverage beginning January 1st. with pre-enrollment starting October 1st. And I'm going to talk probably most about that because that's what my department is involved in. Kristi and I will probably overlap a little bit in some of the things that we talk about because we work very closely with Covered California in this implementation. So the other thing it did is it provided some support for small business. I'll touch on that just a little bit. And then it created a marketplace or an exchange, which of course is Covered California, which you'll hear more about from Kristi, where individuals and businesses can actually purchase health insurance. So California was the first state that actually legislated and passed legislation to create the marketplace. And again, Kristi will talk about Covered California more in a little bit. So how many will enroll? There's all kinds of projections out there in terms of the numbers of uninsured folks statewide, and also I can share what we might expect in Butte County. We know that approximately 1.4 million Californians will be eligible to newly expanded Medi-Cal. There could be as many as 2.5 million that are eligible to the current Medi-Cal program but have never made an application. In Butte County, in preparation for enrolling, there's a number of, through UC Berkeley, there's been a number of tools that were developed to help us anticipate how many people we can may have coming through the doors, but the figures vary anywhere from maybe 9,000 to 30,000. So we really, we don't know, to be honest. We don't know how many, but we know that there's a number of uninsured in our communities. What I can tell you is that currently, close to 22% of the residents in Butte County are already on some sort of Medi-Cal program. That's currently, that's before the Affordable Care Act. And kind of to put that in perspective, I think sometimes when you think of the old welfare, cash assistance, less than 2% of the population in Butte County is on some sort of cash assistance. So that gives you some perspective of there's a lot of people that are working. They're working in jobs that, there's not health insurance offered. And so there is really an unmet need. And we know that there are more people out there. So, from our department's perspective, we're really excited to be part of an effort to reduce the number of uninsured that we have here in our community, because we all want a healthy community. So nearly everyone will be eligible to some sort of benefit. And so in my department, what we talk about is it's not if you're eligible to some sort of health benefit, it's what type of health benefit will you be eligible to. And so, we have our current traditional Medi-Cal program that exists today. There'll be an expanded Medi-Cal program where more people will be eligible to the Medi-Cal program. And then, of course, there's the subsidy or the other health benefit programs that can be purchased through Covered California. So nearly every citizen will qualify for some type of health benefit. And then, of course, there's those citizens or individuals that already have health benefits through their employer, and those will continue. So really, almost everyone will have some sort of coverage available to them. When does this begin? The individual mandate that everyone has some sort of health benefit is effective January 1st. Open enrollment starts October 1st, so that's a week from tomorrow. The pre-enrollment period for the first year is 6 months. So from October 1st through March 31st will be the open enrollment period where people can enroll in some sort of health benefit. After the first year, the open enrollment period is 3 months. October 1st through December 31st. Much like private insurance now, if you've got it, there's usually an open enrollment period where you have an opportunity to switch plans or do those things. It's important to note that the Medi-Cal program and the expanded Medi-Cal program, people can apply all year round, anytime. So it isn't conditioned on an open enrollment period like the other health benefit plans. So that's kind of important to remember, because a lot of people now will qualify for the expanded Medi-Cal program. Just to touch just very briefly on employers, because I know that there was a lot of concern out there for small businesses and how will this affect their business, the ability to offer health insurance to their employees. a note, 95% of the businesses in Butte County have less than 10 employees, which that was interesting to me because I did not know that. Under the Affordable Care Act, employers with less than 50 employees are exempt from the mandate that they provide health insurance to their employees, unless they choose to, but they're not a part of the mandate. So I think that gives you, again, some perspective that for the vast majority of employers in Butte County, they're not under the mandate under the Affordable Care Act. For those larger employees, such as the county, for example, they offer health insurance to the employees and other large employers. So that gives you just a little bit of sense of the business. Some of the things that we're doing for small business is there is a toolkit that has been developed that is available on the Chico Chamber of Commerce website, also the Butte County website, to provide some information for small businesses, because there's also the ability for them to purchase plans for their employees if they choose to. There's some tax credits that may be available for small business. So there's a number of things out there and information out there if you're a small business owner to kind of help you navigate the Affordable Care Act. We have a number of seminars that are also being planned. So if you have an interest in that, you can let me know. So that's a little bit about how this impacts the employer community as well. Questions about where does someone apply? Or how do I find out what I might be eligible to? How does this impact me? Covered, effective October 1st, there will be a total of 35 customer service centers statewide that are charged with the job of assessing and enrolling individuals. 3 are at the state level, 3 state levels customer service centers, and there's 32 county customer service centers. Butte County will be one of those customer service centers. So we are poised and ready to start taking calls effective October 1st. You can also walk into our offices. In Chico, of course, we are the Chico Community Employment Center, which is at 2445 Carmichael, next to the Enterprise Record office there out by Cal Skate. So people can still walk into the office if they don't choose to do this over the phone. But one of the things about the Affordable Care Act and also Medi-Cal currently and the other services we provide is there's a multitude of ways you can apply. You can come into the office if you choose. You can do it over the phone. You can do it on the intranet. You can do it through the mail. So there's any number of ways that you can make an application if you are in need of those health benefits. The other thing that's going to be implemented, and maybe Kristi will have a little more information about this, but there will also be assisters or places in the community that can also assist individuals with enrolling in health benefit in that information. So there's a number of entities and that have been granted receive grants and education on how to assist in the community. So more and more information will start to come out about where you can go. It isn't just traditionally to the social services department. There's also a Covered California phone number, and there'll be a number of other places in the community. One of the things, and you'll hear about it in a few minutes, is the Covered California number when you call. What's going to happen October 1st is they'll do what's called kind of a quick sort. They'll gather some information for those individuals that look like they're eligible to the traditional Medi-Cal or the expanded Medi-Cal program. Those will be funneled to my department to follow through. The other individuals will be addressed and served by Covered California. At the same time, you can also walk in our offices as well. So there's just, again, a number of ways that you can access that. On Covered California, and again, I think they'll probably get into that a little bit more, but you can actually go in right now on the website and put in your information and start to see what might I be eligible to given my specific circumstances in terms of my income and my family makeup, those kinds of things. So I think that I will maybe stop there because I think that some of the other panel members are going to kind of address that, some of the other things.
Tatiana, would you like to go next, please?
Yeah, thank you. Thank you again for inviting me to speak on Covered California and Medicare. My name is Tatiana Fassieux, and I'm the program manager for the Medicare counseling program at Passages. It's called HICAP, Health Insurance Counseling and Advocacy Program. Is the mic on? No? Is the green light on?
Okay, there we go. Thank you. All right. Anyway, I run the Medicare counseling program at Passages, and just a little overview of what Passages is. We are the designated area agency on aging. We covered 5 counties: Butte, Colusa, Glenn, Tehama, and Plumas County. We provide a variety of services, including information and assistance. We run the senior nutrition programs. We have the Medicare counseling program called HICAP, and it's primarily on caregiver support. We have a lot of other programs, volunteer opportunities. We also have a mental health counseling program. But I was asked to come here and speak to you because just by my gray hair is dyed. But I think a lot of you here are on Medicare, and so I'm here to tell you, don't worry. You are covered. You do not have to worry at all about how the Affordable Care Act may impact you in a negative way. As a matter of fact, I will tell you a little bit about how the Affordable Care Act impacts people with Medicare in a very positive way. I put in the back, before you came in the room, a fact sheet that has how does the Health Reform Act affect you if you have Medicare, and on the back side, if you don't have Medicare. So I'll just address the part with Medicare. You probably have already been receiving a lot of phone calls. Most of them, I hate to say this, are fraudulent. There is a lot of fraud happening right now, whether you are on Medicare or not, from individuals that are asking for either your bank account number or your Medicare number because you are going to get a new Medicare card. Well, that is an out-and-out fraudulent statement. Medicare or Social Security, nobody in the government is going to send you a new card. So let me tell you a bit about the positive aspects. If you currently have a prescription drug card or plan called Part D, that donut hole, that infamous donut hole, is shrinking. As a matter of fact, this year you're going to have, or you already have, at least a 52.5% discount if you're in the donut hole for brand name drugs, and about a 20% discount on your generics. You also, as a result of the Act, most of your preventive benefits are free. In other words, your colonoscopies, your mammograms, your PSA tests, as long as there's no surgical procedure, most of the time you will not have out-of-pocket costs. And I encourage you to look at your Medicare and U-Book that you get every year, because you will see an apple next to your preventive benefits. And one of the new ones is your annual wellness examination. That is your opportunity to discuss with your primary care physician what your health behaviors are, what you can change, what can Medicare do for you to help improve your health. As a matter of fact, there's great emphasis on keeping you healthy, because Medicare wants to spend less money on you by keeping you healthy. So there are incentives for providers, doctors, to keep you healthy. There are incentives for hospitals to not get you back in. So within 30 days of a hospitalization, if you are readmitted, the hospitals will be penalized. You won't be, but the hospitals will be penalized monetarily. Increased scrutiny of provider claims. There is a lot more smart programs that are analyzing doctors and other providers that are submitting claims to Medicare, to analyze those claims, to look for trends, look for perhaps potential fraud, so that in the background there will be more scrutiny. As a matter of fact, it used to be that Medicare would just give the providers the ID to be a Medicare provider without a site visit. That is why you have had Medicare providers with a P.O. box in a UPS store submitting claims to Medicare. So this is the primary message to you. Medicare is improving. You do not have to do anything, because if you do, it's going to mess up your Medicare, bottom line, all right? So the one difference, people have asked me, what about pre-existing conditions? Well, it did not impact Medicare as it relates to the Medicare supplements. So we encourage anyone who has Medicare, who has any questions about the supplementary plans. Open enrollment begins October 15th to December 7th for your Part D. And if we have any Medicare Advantage plans coming or staying at this point, I honestly don't think that there will be any valid Medicare Advantage plans in Butte County. And in Butte County, there are about 45,000 people with Medicare, and not all of them are 65 or older. So that's my number. Those are the ones that are going to be calling me. About 60,000 in my 5-county service area. So I encourage you, if you have any questions about Medicare, to call HICAP, and the number is on your flyer. And I will pass the mic to the next speaker, and if you have any questions when the Q&A starts. Thank you.
Our doctor has arrived. I think what we'll do is skip Dr. Thorp for the moment and let him get settled.
Okay.
Is that okay?
Yeah, that sounds good.
He also has a presentation, and I'll need to swing your computer cable over to his computer. Is it a VGA plug on your computer, Dr.? He doesn't know.
Actually, it's okay.
Anyway, Dr. Richard Thorp is an MD, a Paradise resident practicing as an internist, and he is the president-elect of the California Medical Association. And he's here now, but I think we'll go ahead with Covered California. Is it
Yeah, it's
working?
not showing.
The mics are on.
My mic's on.
Better than you.
Right.
She's not speaking yet.
No, I got it. It's just it's where you have to come in. It's still not.
It's there. Oh, it paused.
It's showing here. It's just not showing out there. So.
Where did it function at the...
No, do they advance this way? Yeah. But I don't know. It was working before. Yeah, I don't know.
You might have to restart your computer.
Oh, really? It's on right here. It's. Yeah, it's showing up here. It's just not showing up on the other screen.
I guess I should make sort of the standard doctor joke about being late and having to wait for the doctor, but actually, I was actually seeing patients until just a few minutes ago, so I had to drive frantically down from Paradise. My name is Richard Thorp. I'm a general internist in Paradise, California, and have been there for 32 years. I have the opportunity and privilege to serve currently as the president-elect for the California Medical Association, which is the statewide organization that represents physicians and our patients throughout the state of California and to the state legislature and to the federal government. I will be the president of the organization in about 3 weeks, so it's kind of happening very quickly. Yeah, it's actually for me personally, it's a real honor, but it's also I don't think there's, well, I shouldn't say it. There's been one other physician from Butte County who has been a CMA president. This was back in the 1940s or something, a fellow from Oroville, actually. So I was asked to come tonight to talk a little bit about the implications of the Affordable Health Care Act for the citizens of Butte County, and what, from my perspective as a physician and my position as the president-elect of the association, how we see the Affordable Care Act having an impact on all of us that are affected by health care. Because we recognize as physicians that it's not just affecting us, but it affects everyone who has to access the healthcare system. California Medical Association has had a long-standing policy and a long-standing attitude towards health reform of trying to enable access to care for all Californians. We've held that policy for a number of years. In fact, we sponsored a Senate bill a number of years ago to try and increase access by encouraging all employers to provide health care for their employees. So the idea, when we actually went into trying to influence policy when the Affordable Care Act was being implemented, for those of you who are historical, we were very supportive of the U.S. House of Representatives bill, but we're not terribly happy with the Senate bill that actually had great influence over the final bill, which is what we're left with. Unfortunately, well, fortunately and unfortunately, I mean, I think there are some very good things that happened in the legislation, but there are some unfortunate consequences as well that are still part of the bill. And our attitude has been that we will, it's the law of the land. We plan to work with it. We plan to make it the best we can, just like the Medicare law, when it was initiated in the 1960s, wasn't perfect back then, and we've had a lot of changes that have been made through the last 40 years in the Medicare legislation, and today it's a very different piece of regulatory policy than it was when it started out. So as we've gone forward, there are some things that we are definitely not happy with about the bill, but we do think that it has done some very good things, and primarily, as the people on the panel here, I'm sure, will corroborate, that it's really about trying to make healthcare. It's really a reform. It's really not healthcare reform. It's really insurance reform, and so it gives tax credits and cost sharing to a number of people that didn't have those things before, making it more affordable to them, uninsured consumers, underinsured, and for small businesses. It does create in every state a health insurance market to make shopping for health insurance easier. In California, as you all know, it's the Covered California, which is taking a very aggressive and very proactive stance. Maybe aggressive is not the right word, but a very proactive stance in trying to develop markets and marketing the products, and also to develop health insurance products, include a number of things there. And also, by doing that, it makes the market more accessible, and for consumers, the advantage is it makes it more predictable, because you can really have the ability to compare apples and apples what an insurance product means. It also includes the expansion of Medicaid in California. Of course, that's Medi-Cal, and it does some important things about insurance reform that hadn't been done before, including eliminating pre-existing conditions, eliminating we think very onerous policy of retroactive rescission of health insurance, a number of other market reforms, including spending a certain amount of the health plan's money on actual delivery of health care, and only a restriction to a certain amount of money for profit for the healthcare plan. So what we know is that being uninsured is not a very good thing. It's fairly hazardous. You're less likely to receive preventive services. People with chronic disease, if you're uninsured, you're much more likely to forego necessary treatments, and you're more likely to die from serious illnesses if you're uninsured. Financially, it takes a toll as well because 60% of bankruptcies are connected to the cost of medical care. And for all of those reasons, we, California Medical Association, has been very, as I said, we have issues with the legislation, but we think that we're going down the right track. We're at least trying to do some things that are helpful. If you talk about California's uninsured, we think that there's about 7.1 or 7.2 million almost under the age of 64 who were uninsured in 2010 and 2011. In 2014, most will be required by this legislation to have covered health insurance, and it'll be primarily with 2 additional vehicles. Covered California, as we said before, people that may be eligible for financial assistance for premiums and out-of-pocket costs, and of course the expansion of Medi-Cal, which is a very significant expansion when you look at what it's been before. So I take it there's someone here from Covered California. So I don't need to go through Covered California. I'll let you all do that. But I think the key thing that we've been very very excited to be part of the process of kind of influencing that regulatory policy was that we do think it does have the advantage of providing an apples-to-apples comparison. When you look at a bronze plan in the exchange, whether it's provided by Blue Shield or Blue Cross, it's going to be a similar set of benefits. So you'll be able to compare those set of benefits, their network, what the premium will be, what the deductibles and out-of-pocket costs will be, and then you can compare the price. And if it all works for you, then you're actually comparing pretty consistently. If you try to buy insurance on the private market as an individual, there probably are 50 plans in one variation or another, and they're all a little different, so the prices are all a little different. It's very difficult to try and shop for insurance just out there on the open market. One of the advantages we think that Covered California does provide is that it provides this pretty much apples-to-apples comparison. It also is an advantage in that you can directly access Medi-Cal. If you find that you're not qualified, or if you may find, if you call Covered California, you may be able to find that you actually are eligible for Medi-Cal, and you can get Medi-Cal signed up directly through that marketplace as well, which we think is an advantage. So I'll limit those comments because I don't want to just be redundant here. I think one of the things about Medi-Cal expansion, I know there's someone here from Medi-Cal as well, but Medi-Cal expansion also provides a significant increase in opportunity for those who have not been insured in the past. Mostly this is younger, single men who are typically working but make less than 138% of the federal poverty limit. And if you make less than 138% of the federal poverty limit, then you can qualify for Medi-Cal as a single male, which you've not been able to do before. So the question really becomes, from my perspective, is there's going to be a lot of people, possibly 7.2 million people in California, possibly an additional 20,000 people in Butte County who will get insurance in one form or another. And the concern, one of the concerns that I have is that this whole process of developing a very big highway for people to get to the door of a provider doesn't necessarily mean that you're going to get in the door, because we don't have enough providers. And in California, we've been underserved with physician and non-physician clinicians for a number of years. It's especially in rural California. I run a small primary care multi-specialty group up in Paradise. We have 3 pediatricians, 3 internists, and 3 family docs. And we run our hospitalist program for the hospital, and we run the primary care practice for a rural health clinic. And we've been trying to recruit doctors for primary care for 10 years. And we've recruited 2 doctors. Well, we've recruited 5 doctors, but actually we've recruited 6 doctors, but 4 of them have left. So it's very difficult to recruit because California is a tough market. It's high cost of living in California, so it's tough to recruit to California anywhere, but it's even tougher to recruit to rural California where you have high cost of living and you have a very poor payer mix, meaning that you don't have, in order for a doctor to stay in practice, he's got to be able to financially be viable, and it's very difficult to be viable with Medi-Cal currently because, for instance, a Medicare visit, a standard visit for Medicare is about a $63 or $64 visit, depending on but for Medi-Cal, I get paid $21.50. Well, $21.50 will buy me a extra large pizza. It doesn't really provide enough, and I can feed my staff at lunch, but I can't keep the lights on and I can't hire staff for that amount of money. Even though there is this clause that in the Affordable Care Act that there will be pay equal to Medicare from January of 2013. This is now September 23rd, 24th of 2013, and no one has seen any money. So there's some problems with the model, primarily because there aren't enough physicians in California already. Lots of the physicians are getting gray like me, and they've lived a long time in here and they've practiced a long time, and a lot of them are at a point where they don't need to practice anymore. They love to practice, they want to keep practicing, but if the pressures get too great, there will be some of them who decide to leave. Some of them would decide to say, it's not worth the hassle anymore. I'm just going to go do something else, or retire completely. So just having an insurance card, whether it's Covered California or whether it's Medi-Cal, does not necessarily mean that you're going to have access to care. And I think that's the biggest concern that I have, and we're working very hard to find ways to innovate, to create other delivery systems, to bring on additional non-physician clinicians as practitioners to help augment the healthcare team. But regardless, and we're trying to improve medical school classroom sizes so that we admit more young people who are interested in medicine to go into medical school. But all of those are long and expensive pipelines, and they take time to implement, and none of them have been implemented yet. And Covered California is starting its enrollment in a few days, and in a few months there will be people standing at the door. Unfortunately, that's just the reality of things, and I think it's the reality not just in California, although I think California is one of the places where, since we tend to lead the nation in a lot of ways, California is one of the places where it will become most obvious most quickly. So, thank you.
Thank you. While Kristi's getting set up, I want to remind all of you, you can ask questions by writing them on the cards that the ladies can hand out back there for you, and bring them back up. A number of questions have gone through my mind just sitting here listening to the speakers, so I'm sure you have them. Are you up and running? Somebody pushed this red button and it put everything out, so.
All right, okay. Well, my name's Kristi, and to the left of me is Natalia, and we both went through the certified educator training for Covered California, and we're here to just share information with you about the program. And a lot of it has been kind of covered to the right of me, but we'll just kind of reinforce it and go over it, and we're here after to answer any questions as well. Covered California under the ACA is California's new healthcare exchange, and It's where individuals, families, and small businesses can find affordable health insurance. And so, like I said, tonight we're going to go ahead and tell you a little bit about Cover California and how to get coverage. So, moving right along. I could ask, how many of you have health insurance through your job? Great. And how many of you know someone who is uninsured? Right. Okay. Well, if you answered yes, that's great. And with the Affordable Care Act, your coverage is just going to get only better. And I'll talk about some of those improvements in a bit. And like I said, they've kind of been covered a little bit as well. And if you said no, then as you've heard earlier, coverage is on its way beginning January 1st, 2014, through the Affordable Care Act. Some of the reasons people do not have health insurance is because they might have pre-existing health conditions. It may not be offered through their employer, and one of the main reasons is it's just simply unaffordable. And Covered California is working really hard to find plans that are really affordable for everyone across the board. The Affordable Care Act coverage improvements, it guarantees coverage for everyone. That includes anyone with a pre-existing health issue. There are no annual limits. Rates are not based on health status. It requires the larger employers to provide health insurance, and it's affordable coverage through public and private for the individuals. These are the 10 essential health benefits that Eleanor spoke of earlier, and then as well the panelists as well. But the 10 essential health benefits are going to be included in every single plan. It's not certain plans have it, certain plans don't. Every plan is required to have these bare minimum 10 essential health benefits. Now, who's eligible for Covered California? It is legal California residents. Those that are not are undocumented immigrants and currently incarcerated individuals. So who is Covered California? Covered California's vision is to improve health care for all Californians and to make it accessible and affordable, as well as provide quality health care. Their mission is to increase the number of insured Californians, lower the costs, reduce health disparities, and provide a choice based on your value, what you value in your health care program. They are operated by the state of California. As it was mentioned earlier, we're the first state healthcare exchange formed under the Affordable Care Act. It's one of 17 base marketplaces, and they like us to emphasize that although it's a state program, it's a .com address for their website. It's coveredca.com, but they're still part of the state. And they're also offering name brand health insurance policies, ones that everyone's familiar with. They offer health insurance that's affordable. The premiums are based on your income. Co-pays are going to be reduced. You'll find if you go and check out the plans on the website that co-pays are reduced. There's no deductible for many of the plans, and as Eleanor mentioned previously, there's free preventative care now. So there's no more charges for annual exams and other preventative health care things, and then also the lower out-of-pocket maximums. So this is, Butte County is not up here, but these are just some of the ones in the marketplace. For Butte County specifically, it's Anthem and Blue Shield are the insurance companies. And Covered California, these are the public and private insurance companies that are part of the Covered California plan. As mentioned earlier, for small businesses, Covered California has created a program called Small Business Health Options Program, SHOP for short, and it's for businesses that have less than 50 employees, and they offer these tax credits to help offset the cost so they can actually provide health insurance coverage for their employees if they choose to. And they're also the same plans as they are for the individuals and families, and ones that offer choice as well. And Covered California is all about making the health insurance more affordable. I mean, the two things that people look at are the premiums that you pay and your out-of-pocket costs. And Covered California is working very hard to make plans that have low premium and low out-of-pocket costs so everyone can afford health care. Now I'm going to turn it over to Natalia, who's going to talk about the eligibility requirements for Covered California.
Hi there. Thanks for joining us. So I'm going to kind of get into the meat of the program, if you will. So what does that look like, really? So as you can see on the screen, there's premium assistance, and that's going to be based on your family size as well as your income, some of the qualifying factors in that. So, for example, between $15,000 and $45,000 roughly, you'd qualify for some sort of assistance, and I would say that is the bulk majority of people out in our community right now that are uninsured make in between there. And then as well as the Medi-Cal gap opening up, so now we can see there's no age restrictions with Medi-Cals. Before it was if you were over 21 or under 65, you couldn't access that program. Now you can, and then again your family size is going to come into factor on that one. And so like we were talking about, there is tiers, and these are the tiers that Covered California is going to be using. So we go from bronze to platinum, and based on what works for you is what you would choose. So bronze plan, you're going to pay more of the share, and they're going to pay less of it. And then the platinum, they're going to pay the majority of it, you're going to pay 10% of it. So you can really kind of gauge whether you see the doctor a lot or a little, what plan would suit you best. Obviously the bronze plan is going to be less expensive monthly than a platinum plan, but then again, you're going to be exchanging that for how many services you'll want or need. Standard benefits for individuals. So you can see this is kind of an overview of what the percentages are. So the bronze plan, you can see the deductible is $5,000 as opposed to the gold or platinum where there is no deductible. And so this is almost looking like a plan that you could get with an employer if you're just an individual searching on the marketplace. Before they were much higher than this. Example, you could have a $45 copay. You could have a $6,350 out-of-pocket maximum. And then this is kind of based on, so if you made between $17,000 and $22,000 roughly, your deductible is $500, which is extremely low by comparison to the private health insurance plans that you would get without Covered California. Again, $5 for generic medication is very inexpensive, and then your out-of-pocket maximum would be for a family $4,500. That's very inexpensive, and $2,000 roughly for an individual. And rates are based on your age, your zip code, where you live, your household size and income, and the level of plan that you select. That's going to change what you would pay. Rates are not based on your health status, meaning if you have some pre-existing conditions, your gender, tobacco usage. So I think those are some things people want to know about. This is a hypothetical. So we have Oscar, who's 25. He's single. He makes $22,000 a year. And this would be some kind of an overview of what his plans would look like. So you can see that through the premium assistance, he's saving $144 monthly to receive any number of these plans, and which makes it much more affordable for somebody in his circumstance to get. John is family of two, and so the more dependents you have, the less amount of money you'll have to pay through these plans on both the premium and your out-of-pocket. And so for his family, it was $947. Now it's down to $449, which is half. So you save half, which is really good for families who do make a little bit more, can't qualify for Medi-Cal, and do need coverage. So what do we do to make it smooth? So there's a website. Majority of people are going to be using this website. That's how they really want people to be accessing it. There's a multitude of ways to access Covered California, but if you go to their website, you'll find more information. You'll find calculators to assess how much would this really help me out with, answering questions about general things that Covered California could give you. And then here's some of the information where you can talk to a certified insurance agent, which throughout the county, I'm sure they're being enrolled. There's enrollment counselors, there's service centers, there's obviously the website coveredca.com. You can fax or email. You can go down to the county building over on Carmichael and talk to a social service representative, and they can give you more information. Again, there's sister agencies throughout Butte County that can also assist you and give you more information about the plans. And again, starting October 1st, you can call in and discuss plans. Some of the information they're going to need from you is your Social Security information, how much you make yearly, tax information, pay stubs. So you are going to need to provide some kind of information to them. Initial enrollment. So I know these dates have been thrown around a lot this evening, but again, it is October 1st that the initial enrollment for these plans do begin. Again, there is 60 days within certain life-changing events, such as a divorce or childbirth, where you can change your plan. So unlike Medi-Cal, where you can change that or enroll in that anytime you become eligible, with this 60 days within a certain life-changing event. And you can check with those enrollment specialists if you're confused if that qualifies as a life-changing event, if you have something that's not necessarily a divorce or birth of a child. And then from here on out, after March 31st, the enrollment period will be October to December each year. And representatives are available. So this is the service line. They have a lot of different languages they can speak in. They're open on Saturdays. It's 8 to 8, 8 to 6, Monday through Friday, before October. So if you had questions now, you can contact them between the hours of 8 and 6 p.m. After October. They'll open their lines up a little bit longer. And so there's a lot of enrollment counselors out there. We are not enrollment counselors, we're just certified educators, so we're just here to share the information with people, but it certainly doesn't mean that we can't get you in touch with people that can enroll you. So if you have questions after this, you can always come talk to us and we can give you some more information. And this is the address and phone number, so if anybody out in the audience has a pen handy and wants to jot this down, obviously you can see there's always social media sites, so Facebook, Twitter, YouTube, Google, you can find more information out there. And there's a lot of information online. And you actually, I don't know if a lot of you have heard the radio station is playing ads, you're starting to see commercials. We're just trying to familiarize our communities with what this is, because a lot of people aren't sure or even know Covered California exists. So that's it, and if you have questions, we'll answer them at the end. Thank you.
I'm going to turn it over to our professional question askers now. Carol Burr and Betsy Kruger will work the questions to the panel.
Well, I think we're trying to kind of group them, and it's because there's a lot of overlap in the questions. But one of the questions that's coming up over and over in a variety of ways is what constitutes the evaluation of income. If you're married, for example, and one of you is covered and the other one is not currently, when you figure the income, are you figuring it for the couple or for each individual? And then, is it taxable income or gross income? Does anyone have an answer to this question?
I believe it's gross income that they're going off of, and that it can change depending on the family size, like it says, but the determining factor would probably have something to do with the poverty level, the federal poverty level, and how they determine the numbers of what range that would be for an individual, for 2 people, 5 people, etc.
So at this point, it is not firm how that's going to
Well, not that it's not firm. They've set these guidelines, so they are firm, but in how they determine those guidelines, I'm not 100% sure. I would think it has to do with the poverty level, the federal poverty level.
Okay.
Well, and when we look at Medi-Cal and the expanded Medi-Cal, we do look at the whole family. So we would be looking at the income to the entire family,
entire family.
to make a determination, and then based on family size. So your question about would we look at if one is covered and one is not, we're going to look at the whole family.
You're going to look at as a package kind of.
Right.
Okay.
If it's a married, kind of intact family, yeah.
Okay. Another question that has been coming up here are questions about whether if your insurance cannot be withdrawn because you need it, which is tend to be, can the rate be increased? So if you are sort of taking advantage of your coverage in some way that seems past a certain limit, can the insurance rates be raised? Can the premiums be raised?
Not to my knowledge. I believe if they contacted a certified enrollment specialist, they would be basing that on the individual situation, but I don't believe at this point that they would increase it. Based on the Affordable Care Act, we're trying to make it more affordable, not less affordable.
Okay. A couple of questions about dental coverage. Does anyone know whether that is part of this package?
And that is included in those 10 essential benefits that we have read. So dental and vision are included.
Very good.
Just to add to that, I think one of the, once the premium has been set, thank you, once the premium has been set, the premium will not change. However, in order to set the premiums, if you have insurance on the individual market today, depending on what your age is and what risk, what medical problems you have currently, my understanding is that if you're a younger person, your rates will probably increase, and if you're in the 45 to 60 range, your rates may decrease as you're going forward.
Okay.
Along with the
Dental and eye, are prescriptions covered with the insurances?
They are, and the price will vary depending on your plan, but they are covered.
Can doctors refuse to take patients or hospitals refuse to take patients? Maybe it goes back to the issue of supply and demand?
Well, it's different for hospitals and physicians. Hospitals, once somebody comes to the emergency room, the hospital cannot refuse to care for them, regardless of whether they can pay or not, whether they have an insurance plan or not. So that's the ERISA law that it basically is federal offense if they turn somebody away without doing an evaluation of them. However, that's different for physicians. Physicians are not obligated currently to basically it's whoever they have a relationship with, whoever they want to see, whatever insurance plan they've negotiated with to accept patients from them. Those are the patients they're obligated to see, but not just anybody that shows up at the door.
And does that go to your point that you may be insured but not be able to find a doctor?
That's correct.
Okay.
If I could add something else, there's a lot of misconception about coverage. Covered is one thing, but depending on the plan that you have, if you have a $5,000 deductible, you are technically not covered because you have to pay out of pocket. So whatever insurance a person is deciding upon, it's just like buying fire insurance for your home. How much risk are you willing to take on your own? What is your crystal ball with your health care? What is your family history with respect to your health care as you could look into the future, into the next year, and then you could decide, all right, I am willing to risk 10%, 20%, 40% of my health care costs. And so the younger generation who's considering an Affordable Care Act plan, perhaps they may be less apt to buy a higher coverage than perhaps a 40 or 50-year-old. So you've got to be very careful in the nomenclature. Covered and what you will be responsible for are two different things.
Thank you, and I gather they always have been. Yes. There are questions about the increasing costs of insurance. Kind of, I don't know whether it's leading up to this or whether, but just over the last period of time, it seems to be a fairly sharp increase in the premiums.
Perhaps I could address that.
Yeah.
We have been getting calls from Medicare beneficiaries complaining about their Medicare supplements going up. That has routinely gone up, depending on age and where you're living and so forth. And it is the same thing in the private market. There hasn't been any statistical evidence that insurance premiums are directly related to the Affordable Care Act. What is appearing is shifting to the individual. For example, if somebody has an employer plan, there is some evidence right now of large employers changing the way they offer their health benefits to both their employees and their retirees. But that has also happened over the course of several years. So it's just a wait and see now.
Thank you. Boy, there's so many questions here. If people feel as though they can't afford to pay anything, but when you go to evaluate perhaps the salary that they had at some point, or there seems to be some concern that there will be no way to, in other words, not to qualify for a subsidy, but not to be able to get insurance without one.
So you're saying that because it's all based on the income, and so that's the whole goal of Cover California and providing the health insurance. I mean, in going back to your last question too, I think maybe until now people have seen premiums go up or insurance plans changing, and that's what's all going to change January 1st with this whole Affordable Care Act, falling into place. And so, I mean, that's why there's all these different tiers that Natalia had talked about earlier, so everyone can find some plan that's suited for their lifestyle or whatever, that's affordable. No one's going to be really left out. And then if they make not enough, then they'll go to Medi-Cal or any other type of assistance. So more than not, everyone's going to qualify for some sort of assistance.
One question that came up is that you may have noticed there's been some discussion in Washington about figuring out a way to unfund this ACA. Any sense of how that might play out or what effect it's having on I know it seems to me, as you were pointing out, California has been sort of at the head of the line in its efforts to implement ACA.
Right, the first state to enroll it, true. No, I mean, everything is just systems go, I mean, we've heard all the news and everything else, but it's pretty much full speed ahead, so.
Okay.
So you feel that California is committed to the exchange process regardless of maybe what's going to happen in Congress?
Well, as far as we know, yes.
Okay.
Of course, if something changes in Congress, it could change everything. But I think a lot of people are afraid because it's not maybe exactly what they envisioned it to be. And it may not be the most perfect situation for everybody, but it is progress and it is becoming more affordable for people.
Yes, because I mean, one of the questions had to do with single payer, and this clearly is a blend. In a way. I mean, it's an effort to cover everyone, but it's still using the private market. So any sense about this combination or what its relationship would be to a single payer plan?
This is definitely not a single payer plan.
It's definitely not a single payer.
But I mean, we can all speculate about what's going to happen in Washington, D.C. We have a Republican-controlled House of Representatives, which has made some statements to try and pass some legislation. It has to get through the Senate, which is a very significant obstacle, and it has to get past the president's desk,
Yes,
which is a very significant obstacle.
yes.
This president is unlikely to sign a bill that would defund his landmark legislation.
Yeah.
I'm just speaking about this not from my own personal political views, but just looking at the politics of it. So I think it's very unlikely. I will tell you that in my experience, the state of California, from the highest levels, the governor and the leadership of the assembly and the leadership of the state senate are clearly committed to this path of Medi-Cal expansion and the health benefits exchange, and they're not in any way, shape, or form backing away from that. They certainly aren't directing their regulatory personnel and staff to back away from it. They're clearly moving forward to implement this.
Are they also moving forward? Another question that came up is there a strategy then for increasing the number of providers for the increased number of people who will be covered?
Well, unfortunately, their enthusiasm for increasing enrollment hasn't been met by increasing providers. And the other thing that is a little puzzling to me personally is that they haven't actually been doing anything significant to try and increase provider enrollment. You know, I mean, in Medi-Cal, there's no real push to try and increase the number of providers that are willing to do Medi-Cal. And that's, in fact, there's a real obstacle. It's very difficult to become a Medi-Cal provider. So it's a kind of a funny dichotomy, but for right now anyway, they clearly are very aggressively going after enrolling clients and consumers into either one of the other, either the health benefits exchange or the Medi-Cal expansion. But I will say there isn't a pipeline for expanding the provider network, and there isn't in my view, there's not a real push to try and increase provider enrollment in those delivery products.
What I have seen has been an increase in rural health clinics. For example, here locally, Ampla Healthcare has really expanded, and they will be obviously accepting the increased demand. Whether they can meet the demand, that's a whole different question. But the federal government has infused a lot of money into the expansion of rural healthcare, and so Feather River Hospital also has that designation, and in areas where I serve, the Indian health clinics, for example, those are also expanding and are opening their doors to non-natives too. So there will be definitely a sort of a bottleneck for the time being, but hopefully I don't know how to increase the attractiveness of Butte County or any other counties. Doc in the boxes, that nationally is happening, where you see pharmacies having their own little clinic, if you may. The Walmarts of this world may end up having a physician assistant to meet the primary care needs, because that, you know, I would be interested to know whether the California Medical Association has any opinions or is supporting that.
Supporting say a Walmart having a physician, yeah, PA.
The California Medical Association has a very strong relationship with Physician Assistant Association in California. We partner on a number of things. We believe that physicians should be leading the healthcare team. We don't believe that nurse practitioners or physician assistants should be operating independently. We feel like that's second-tier healthcare and doesn't really provide the quality of healthcare that we've always come to expect in California.
Yeah, so since I don't know the regulations of setting up something like that, I'm sure that you have to have a physician overseeing that. That's all in licensing, so that's way beyond my pay grade.
Could I say something? The literature that I've read says that the PAs and the nurse practitioners, just like the MDs, are specializing. They're not going into family practice. So we don't have an abundance of those types of caregivers in the area where we need them. They too want to specialize. They want to work with an orthopedic surgeon. They want to work with, that's where they want to go. So is that what you understand too, Doctor?
Yes. If you look at statistically, physician assistants, nurse practitioners,
Yes, please.
distribute very similarly to the way physicians distribute. And often it has to do with, a lot of physician assistants, nurse practitioners congregate in urban areas because it's a more, it's more attractive to some people to live in an urban area. Not to me personally, but to some people. And there are financial gains to be made as well there. So the idea that somehow nurse practitioners or PAs, physician assistants, are going to redistribute to a more rural area just because of their training is really not proven out to be the way it is working out in terms of the practicality of things. I mean, I use a PA and nurse practitioners in my practice, in my private practice, and I also work with a number of them at the Rural Health Clinic as medical director of the Rural Health Clinic in Paradise, and they're very fine people. They do a great job, and they provide a great service. The difference is that in those venues, they're supervised by physicians.
One speculation as to why so many people remain eligible for Medi-Cal but do not apply is because of the complexity of the application process. And I was wondering if some of you could address the complexity. And along with that, I know that for Medi-Cal there has to be a review of assets as well as income, and how will that be addressed in the future?
I can speak to that a little bit. It is true that the application process has been very onerous, and as part of this process there will be a streamlined application. It's although I think the streamlined is 22 pages, but my understanding is that essentially the first 6 are what the majority of people have to complete, and so the hope is that that's going to enhance the ability for more people to enroll. The other thing that we have seen in the past several years is the ability to apply online, which you can do currently. That has really expanded the numbers of people that we're seeing enroll because they're not having to come into our offices, which can be a lengthy process, and people don't want to do that. And so we're hoping that the shortened application process will make it easier and more accessible, as well as all the different venues and ways that you can apply. The other thing on the assets, currently that's true in traditional Medi-Cal, there's an asset test, if you will, as well as the income that we look at. With the expanded Medi-Cal, there is no asset test. So we're going to continue to look at income, as we stated earlier, but there is no asset test with the expanded Medi-Cal. So again, it really is going to open up eligibility to, a large number of folks. There has been some marketing of Cover California recently. We've not really done the big push yet, if you will, to try to get, more of those Medi-Cal people enrolled, and we'll be doing that as well. Particularly the young, healthy folks that will be eligible now. When you're 25 and you're invincible, you think you don't need to apply for coverage, and we really want to try to reach out and have talked to, Chico State and Butte College and in places that we can access young people so that we can really get the word out in terms of trying to get them enrolled, many who will be eligible to Medi-Cal or the expanded Medi-Cal program.
Another question that came up is related to the long-term care benefits available now under Medi-Cal, and how is that going to be addressed with the Affordable Care Act?
Are we talking about skilled nursing care?
Yes.
That hasn't changed to my knowledge. The asset and the income eligibility is the same. You in California and federally, that will be moving that way too, is that there's a Spousal Impoverishment Act that allows the stay-at-home spouse to keep more assets. But the eligibility for Medi-Cal for long-term care, I don't believe has changed at all.
What about when people are, well, an example would be these larger employers who are dropping their insurances for their employees and saying that they can go into the exchanges, probably cheaper or better. And then also, I think part of that question is when people leave an employer who provides health care and know that they are going to be getting a job where they will also have health care coverage with their employer, but there will be a gap, maybe a month or two. Is there something that will cover that period of time?
Perhaps I could address one part of what I've heard. We already know that employers that have 50 or more employees are going to maintain their health care coverage. So what I believe you're hearing lately in the news is large companies are discontinuing, if you may, their retiree coverage in favor of a pseudo-exchange. It's not the exchanges that we're talking about here. We're talking about retirees who also have Medicare, that the IBMs of this world, we've already counseled some individuals who are retirees of IBM who have received this package. And it's not new to because of the Affordable Care Act. Montgomery Ward's, when they went bankrupt, they dropped their retiree coverage. GM did the same thing. They shifted their way that they were giving their retiree coverage. So specifically as what you're hearing now is that, and it has happened with other employers, where the retiree is given X amount of money to buy a supplementary plan to Medicare from a Medicare supplement exchange. It's the different exchange, but it's basically a broker that represents many Medicare supplementary companies, and through some kind of an agreement with the larger employer, they're directing their retirees to this brokerage company to offer them one of the 10 standard Medicare supplements. I don't know how those premiums will be in comparison to if you went to a local broker that sold, for example, a Blue Cross F plan. But that is the shift that perhaps more employers are going to do with their retiree coverage. But when it comes to large employers, 50 plus, they can't shift them to the exchange.
What I will say we are hearing more anecdotally is that some employers are not hiring full-time, because if they're not offering full-time employment, then they don't, if you're a part-time employee, then they don't have to offer. But that's something, quite honestly, that has been happening for years before the Affordable Care Act as well. So I don't know if that's really increasing as a result of the ACA or not.
There was a request that your PowerPoint presentation, is it available in any other format? People were having a little trouble reading what was on the screen, and they wondered if there was a print version.
Yeah, you know what? A lot of the information that was in that PowerPoint presentation can be accessed through coveredca.com. They have it's a really great website that's designed for usability and accessibility of information. So there's fact sheets, and I put also a flyer out there as well that talks about the different rates and how you can get assistance and everything else. But if you go to coveredca.com, all that information's right there.
Thank you. Do you have more? Yeah, I think.
Oh, there's a lot of questions.
Yeah.
But how some people have gone to medical savings accounts, and how are they going to be addressed in this Affordable Care Act? The exchange.
Again, commercial insurance or existing insurance does not change. So if you have a medical savings account coupled with a high deductible plan, you can choose to keep it or explore the plans that are available through Covered California.
So you could have both?
No, you can't have redundant coverage. You can't have duplicity of coverage.
Okay.
But you could perhaps, and that's a question that I would ask the individual's company that they have this plan through, if they dropped their health insurance coverage, let's say they have a $10,000 deductible and a medical savings account, could they use that medical savings account to pay the premiums of a covered California plan? That's a question that somebody needs to ask.
Okay. There was a question that sort of suggested that from CMA's perspective, what should we be pushing for, or what should we be saying to our representatives? Is there something we should be saying to them based on this somewhat varied support for the ACA?
Well, as I said before, I mean, we treat the Affordable Care Act as law. It is the law of the land. Our policy is to implement it in the most effective way possible. We have some personal things that we think are not good for the long-term viability of the program. But I wouldn't say that that's something I would ask you all to advocate for. I mean, I think the thing that we all need to think of is, for one thing, I have to say, I mean, I did not vote for this president, and just going on record to say that, but I do have to say that I have to have a fair amount of respect for the stand that he took. I mean, we've had a number of presidents before. We've had this healthcare crisis for 25 years. The healthcare system in the United States is not working well, and it's working less well the farther we go down the line. We have some of the best healthcare in the world, you know, in terms of individual things that you can get here. People fly from all over the world to have their hearts operated on, their hips operated on, their brains operated on, to get care from some of our doctors. But that's different than a healthcare system. And we've had problems for a number of years. This is the first time that we're having, you know, multiple town discussions about healthcare. And I think this is something that we do need to do more. I think one of the things that I am encouraged about with the Affordable Care Act implementation is that there actually is ongoing discussion. People now are very concerned. We're all talking about healthcare, and it's on the national agenda. So I think that's something we need to realize, is that, do we believe as a leader of the world of nations that we can exist as a country and have 30 to 40 million of our citizens not insured with health care? Is that really the kind of community we want to be part of? And do we really expect that? I think that means we're going to have to reorganize some of our priorities. And I mean, there's a limited number of dollars out there to use for all the things that we have to do. We have to educate our youth. We have to provide health care for some of us. And we're looking now at providing health care for more of us, which is going to be more expensive and more dollars. We've got to defend the country. We have to provide, the kind of military that will prevent other countries from dominating the world in a way that's unacceptable to us. But as a community of citizens, we have to come together and kind of work on what do we think that those priorities are. I think healthcare is an important part of that mix. I don't think it's the only thing, but I think it's an important part of that. And this is one of the, so I would say, I think it's important to stay active in this conversation, be educated, these kind of forums are, I think, very helpful, very educating, and learn as much as you can about the process. One of the things that I think is an advantage of the current process is that it is more transparent. It's easier to understand this than it has been in the past. So, there's going to be change. We're going to all find that we're going to be changing as we kind of travel through the next 10 to 15 years. What we want is we want to see change that is actually improving things for the majority of people, and we're working on trying to improve the healthcare delivery system from the physician side so that it's actually is more efficient, is lower cost, does provide a better product, and is more consumer friendly than what you may have encountered in the past. But those are long-term projects. They don't happen overnight, and I think you'll see those things evolve over the next 10 years, but it's going to take some time for that to happen.
Thank you. Are there good ways, I mean, are there places that you would recommend people, a phone number or a website other than what you've provided that you think people in the audience might benefit from knowing so that they could find out more from passages? I know all of you have websites, so I'm assuming that's one approach, is to go to the websites.
It would be nice to have, you know, that people could contact somebody local.
Yes. Is there a good
Well,
look?
for example, anything to do with Medicare, and if you're 16 above, you call Passages. You can call us at 1-800-434-0222. That is a statewide phone number that reaches all of the HICAPs in California, so it's prefix-based. But we don't specialize in specifically covered California because, but yet, we will get calls from the 60 to 64-year-olds, and we will be referring them to Covered California. And if perhaps your organization were willing to give us your phone numbers, you know, you've got your community educators.
Great. So both Natalia and I work at Women's Health Specialists, and we are available all day, every day, if anybody's interested in just talking more about Covered California and learning more about what plans are available and what you qualify for. But you know, it's just like the doctor had said too, like if you go on the Covered California website and you plug in your information, you can access all the different plans, and it's like apples to apples comparisons, and you can really kind of see it. It's very transparent, and it's very user friendly, and it's tailored to whatever you value in your health insurance coverage, and so you know, all the information's there. But like I said, Natalia and I are here locally. We're also going to be a sister organization as well, providing enrollment for Covered California as well. So.
And also, there will be, as I understand, insurance agents that are actually certified by Covered California.
Yeah, actually true. We have a colleague that we work with that went through a private insurance, and they have this same information that we got through Covered California. So you'll find as time goes on, more and more insurance companies will also have the same information.
Cathi, and maybe then after Cathi, we should wrap it up.
Yeah. And I was just going to add that you can also come into the community employment centers if you want to come in and talk to someone as well. So
I think we could go on longer. We have more questions, and I'm sorry if we didn't get to your question. It's been an hour and a half. We had 4 speakers that I enjoyed very much. I hope that it was meaningful for all of you, and I'm sure we'll continue with this topic. The League has been interested in healthcare for many, many, many years, and we're supporting this law because it's law, and it wasn't exactly what we've been working for, but it's really pretty good, and it's going to get better if we all, you know, keep working on it. So thank you very much for coming.